if you have diabetes or issues with your insulin, you may have heard of a new weight loss drug called Mounjaro. The problem is recently Mounjaro has grown in popularity, and it is a shortage right now with Mounjaro.
Some celebrities and social media influencers are using a new diabetes medicine to lose weight, but their popularity is causing shortages.
And a lot of people who actually do have diabetes cannot access it because people have found out about its weight loss benefits. So people who don't have diabetes are actually taking Mounjaro just to lose weight. Now, the weight loss that has been reported with using Mounjaro is actually something that I've never seen before in the weight loss industry. It actually is helping people lose weight without really doing much else but taking this medication. However, did you know that there are actually all natural alternatives to treat diabetes and insulin issues? And this goes for people with diabetes, pre-diabetes, as well as PCOS. There are over-the-counter all-natural supplements you can take that can help regulate your blood sugar, help treat PCOS, and can help treat the symptoms and reduce the effects of your diabetes. So in this video, we're going to be talking about the top 4 all-natural supplements that you can take to help fight diabetes and insulin issues naturally. What's crazy is a lot of people don't know this, and I would think that people who go see their doctor for diabetes, they would try to treat it naturally before putting someone on a medication with side effects or insulin. But a lot of people don't know this stuff. The only reason why I know this is because I've done a lot of research because I have PCOS. So I was doing research on how to treat PCOS, and that is how I found out about these supplements. So I'm gonna go over each supplement individually, and you can decide whether you want to include this in your regimen. Now, before you go add these supplements to your diet, make sure that you talk about this with your primary care provider before making any changes to your routine, because I am not a doctor. I just happen to know a lot of stuff. Number 1 first is Berberine. Berberine is a natural compound found in herbs and plants, and it's been used for thousands of years to treat a variety of diseases, including diabetes and high cholesterol. Berberine also helps lower blood pressure, which can help prevent heart disease. Berberine has anti-inflammatory properties, so it may be able to reduce joint pain as well. Some research suggests that taking Berberine can help you lose weight if you have diabetes or metabolic syndrome, which is a condition where you can have a high blood pressure, high cholesterol levels, obesity, and other risk factors for heart disease. And actually, Berberine has grown in popularity the last year or so. I actually take Berberine on my own to treat my PCOS and just to like handle to regulate my blood sugar. But it's been growing in popularity, and I think it's gonna be like the next new popular, like, you know, all natural supplement. You know, like supplements, they kind of go in phases of which one is popular. I think right now it's like sea moss and some stuff. I think Berberine is gonna be next. I just realized that I actually have most of these supplements that I'm mentioning in my cabinet. This is the Berberine that I take. I'm gonna list them all in the description, but this is the one that I take. I get it off of Amazon. So number 2 on the list is alpha lipoic acid. Alpha lipoic acid is a powerful anti-inflammatory that can help regulate blood sugar, support weight loss, and is also an antioxidant, meaning it can help fight against free radicals in the body. Alpha lipoic acid is present in every cell in the body already, but it's especially concentrated in the mitochondria, the part of your cell responsible for energy production. In fact, alpha lipoic acid helps to recycle other antioxidants such as vitamin C and glutathione, so they can do their job even better. Alpha lipoic acid plays a big role in the breakdown of carbohydrates, so it helps prevent spikes in blood sugar levels after meals. Studies have shown that alpha lipoic acid may help prevent type 2 diabetes by reducing insulin resistance and inflammation in overweight people. I actually haven't taken alpha lipoic acid in a while. I've had this in my cabinet for a while, but like I said, guys, I take these when I was trying to treat my PCOS naturally. Right now, the only one I currently take on a regular basis is the Berberine and the one I'm about to mention next. Number 3 on the list, and this is especially important for people with PCOS, is Inositol. So inositol is a naturally occurring nutrient that's known to help treat insulin resistance in women with polycystic ovarian syndrome. There are two types of inositols. You got myo-inositol and D-chiro-inositol. These two forms have different purposes, but they both have the ability to sensitize your cells to insulin so glucose can get into the cell to be used as energy. This helps reduce glucose levels in your bloodstream and increases insulin sensitivity, which can improve ovulation frequency and function. Because if you guys don't know, PCOS, people with PCOS can suffer from infertility issues. So when we regulate our insulin, it actually helps to get us more fertile. And a lot of people who try to conceive who have PCOS, they can't conceive. But once they start to actually control their insulin, like once they start controlling their insulin with these supplements or even their diet, I heard a lot of women who get on keto diet, they just pop up pregnant. So regulating your insulin is very, very important if you have PCOS when it comes to weight loss and fertilization. D-chiro-inositol is made from myo-inositol, and it's known that women with PCOS excrete D-chiro-inositol 6 times more than a woman without the condition. As a result, finding a product that contains both can be immensely beneficial for women with PCOS. PCOS. The one that I have is a myo and a D-chiro-inositol. Okay, so this one came highly recommended to treat your PCOS, ladies. Number 4 and last on the list is chromium. So chromium, I used to take it, I don't take it currently. Chromium is a trace mineral that plays an important role in blood sugar regulation. If you have diabetes or at risk for developing it, you may have heard of chromium as a potential supplement to add to your daily routine. But how exactly does it work? So chromium actually helps the body use insulin more effectively. Insulin is a hormone that is responsible for moving glucose, a type of sugar, from the bloodstream into the cells where it can be used for energy. When insulin isn't working properly, blood sugar levels can become elevated, which can increase the risk of developing type 2 diabetes. So by supporting your insulin function, chromium can help transport glucose into cells, thereby helping to regulate blood sugar levels. Some studies have even suggested that chromium supplements may lower the risk of type 2 diabetes. These 4 supplements have been backed by science as aids to regulate blood sugar. If you want to naturally regulate your blood sugar, all 4 of these supplements are safe and effective. They have been studied and proven effective in helping people with diabetes and prediabetes and insulin resistance and PCOS. So hopefully by the time you watch this video, you might be able to find some Mounjaro at your local pharmacy. But if not, you might want to look into these. They're all linked in the description. Just make sure you talk to your primary care provider first, okay, before taking any supplements. Talk to your primary care provider, all right, especially if you're already taking diabetes medication. Because if you're taking metformin and then you mix metformin with any of these, your blood sugar can drop too low. Now you got other problems. So please make sure you discuss with your doctor, okay? I hope you guys enjoyed this video. Make sure to comment down below and subscribe for more health tips. And I'll see you guys later. Bye, guys.